Welcome to Boston Children's Answers Parentcast. I'm your host, Jennifer Arnold. As a doctor and a mom, I'm passionate about helping kids stay happy and healthy. So join me as I chat with other Boston children's experts to find answers for you and your family. Hey everyone, and welcome back. Today we're talking about Lyme disease and ticks. All the questions that parents may need to know: how to protect yourself and your kids, what are the signs and symptoms, and even how to debunk some of the myths around it. So, as always, let's start off with a question from our guest parent.
Hi there, my name's Nicole. My son was on a hike with me yesterday and we found a tick on his back. We got it off, but now I'm worried. How do I know if he's at risk for Lyme disease?
Thank you so much, Nicole. That's a really important question, and I think today's conversation is going to help put you at ease. Today we are talking with Dr. Molly Wilson-Murphy. She's a pediatric neurologist here at Boston Children's Hospital, and she is also an expert in Lyme disease. Thank you so much for joining us today.
Thanks for having me.
One of the things I like to start off every conversation with our guest experts is getting to understand how you got into the field. So how did you get into being an expert in Lyme disease?
My path to medicine wasn't exactly direct, but when I was a child, I actually had migraines, and so I followed with a pediatric neurologist myself. And then when I was going through college, I actually studied cognitive neuroscience, so not too far from pediatric neurology, but I wasn't planning on going to medical school initially. My mom actually was a special education teacher, and so I had some exposure to children who have developmental and learning differences from early in life. And so it's not entirely surprising that that's where I ended up. But when I was getting to the end of undergrad, I thought more about my future, and I really saw it in medicine. So then I spent actually some time with my own pediatric neurologist shadowing him.
Oh,
yeah. Years later.
Yeah. Oh my gosh. Yeah. And now, does your pediatric neurologist still know that you're in this field?
He does.
That's awesome.
He does. We've kept in touch, and he's now mostly retired and playing tennis, but we keep in touch, and he will intermittently send me an old textbook or some article that he's found, and we send him a Christmas card every year and tell him how we're doing.
I just love that story. I think it's so incredible when, we have our own doctors that influence us to go into our fields, and I'm sure he's very proud. It's amazing.
Thanks. Yeah, I hope so.
Oh, I'm sure. Well, thank you for sharing that. As we think about, Lyme disease, can you help our audience understand really what it is and how you might get it?
Sure. Lyme disease is a bacterial infection that's transmitted by the bite of black-legged ticks. A common misconception is that any tick can transmit Lyme, but it's actually just the black-legged tick or the deer tick, which are those tiny, tiny little ticks. So if you find a tick on your child and it's not small, there's a fairly good chance that your child is not at risk of Lyme disease.
So that's really important, I think, because you're 100% right. I feel like, I have friends phoning in, to me as the doctor, like, oh my gosh, I found a tick on my child. What do I do? And you have to really explain what kinds of ticks are the ones that could carry Lyme disease.
Yeah, there are visuals that you can look at of dog ticks versus deer ticks. And if you find something that looks more consistent with a dog tick, then you can be very reassured that your child is not at risk of Lyme. Another myth is that Lyme can be transmitted right away. And actually it takes at minimum 24, but really 36 to 48 hours or even longer to transmit the infection. And so if your child has a tick that's crawling on them, not yet attached, or a tick that is attached but is not yet engorged, you're safe and your child will not contract Lyme.
I imagine a lot of parents are calling their pediatrician as soon as they find a tick on their child, and to know that you have that window, it's really reassuring.
Yeah, absolutely. And I think too, parents will see, for instance, that their child has had a tick bite and automatically think that that's Lyme, and not necessarily. So ticks will carry other bacteria, and so you can have a local reaction either to the bite itself or a little cellulitis, which is a little skin infection, not Lyme, that causes a rash. So not all rashes after a tick bite also are Lyme.
That's really good to know. And we're going to deep dive, I think, a little into the signs and symptoms.
Sure.
But as I think about, where are ticks prevalent? So I grew up in Florida. Since I moved up to the north, I am much more alerted about the risk of ticks.
Yes, and it's a very important point that it's not just where there are ticks, but where ticks are infected with Lyme. So the Northeast and certain parts of the country are higher risk because the tick populations and the animals that they feed on are infected with Lyme. So that's an important piece of all of it. And then it's not just within the geographical area, but also what you're exposed to. So ticks love long grasses, they love brush, they love the edge of woods where there's shrubbery or grasses. If you're in areas with long grasses or brush or shrubbery, those are places where you're at higher risk of being exposed to ticks.
My daughter, who's in Camp Away right now in the woods, is probably in a higher risk environment.
Absolutely.
But maybe not so much in my backyard, although if we do have like deer passing through, should you be worried?
Absolutely, yes. So these ticks, like I mentioned before, they're black-legged ticks. They're also known as deer ticks. They feed on white-tailed deer and also white-footed mice. Oh. And so if you're in an area that has a lot of white-footed mice in the woods or you have deer, certainly that would be a place that's at risk. But there are things that you can do to be mindful when you're going into those areas and exposing yourself. So it's not just the exposure, but it's when you're going into those areas, how you're dressing and things like that can also help protect you.
So we're going to talk about that because I think every parent needs to hear this.
Yes.
Well, let's talk a little bit about Lyme disease in and of itself. So
Sure.
Is it very common? And, what are some of the myths that we need to sort of debunk?
Sure. So Lyme is actually the most common infection that's transmitted by ticks. And about 300,000 people are affected in the U.S. every year, and more than half of those are children. The most common signs and symptoms are things like fatigue, fevers, headache, maybe a rash. We have this sense that you have to have this targetoid bullseye rash, and that's a bit of a myth or a misconception too. So most people who have Lyme, if they have a rash, it's not a bullseye. It's actually more commonly just a circle that's completely filled in red. And many people who have Lyme don't have a rash at all.
You don't have to have the bullseye rash to have Lyme disease.
Right.
And if you have a red rash, it may not mean you have Lyme disease.
But it may.
But it could.
Right.
Oh,
so
okay.
see your doctor. If you have a known tick bite and a rash, and it's during, the months where ticks are more active, so April through the fall are the months where ticks are more active and you're more likely to contract. But the other thing to know is if you're out in the woods and there's not snow on the ground, ticks are out. They're not as active, but you can actually get Lyme like in the fall or the early spring even.
That's important to know too, because here, one of my myths, I thought it was just really an issue in the summer.
Right.
But we're outside more. Maybe that's really more the issue.
We're outside more. We're wearing less clothing. So it's the exposed skin where the ticks can actually get onto your skin. In the winter, we're oftentimes very covered and they can't get to our skin.
Okay,
so that's another way to protect ourselves is how you dress.
We talked about sort of like the signs that you may have Lyme disease and the exposure risks. Now, how do we protect ourselves if we're in those areas? It's a great question.
Because we don't want families to be inside so afraid of Lyme that they're not enjoying our wonderful outdoors. That's really important for health too, right? Is spending time outdoors and being active. So a few things that you can do. Long sleeves, long pants. Now, colors. Colors of clothing is a little bit nuanced and interesting. When I was growing up, we used to always say you'd wear white and light clothing so you can find them. But we actually now know that the ticks are attracted to white. They're attracted to the undersides of deer that are white, and so they instinctively are attracted to white. So if you're wearing white, you might see them more easily, but they might be more attracted to you. So I usually say light clothing that's not white, maybe like light blue, light pink, not black. It's hard to see them on black.
Oh man, I just sent my daughter to camp with white clogs that she had to have.
Tucking your pants into the socks so that there's less skin exposed there. And then just long sleeves like we talked about before.
Okay.
Yeah.
So
and then before you go out, there are a couple things that you can do in terms of treating yourself and treating your clothing and shoes. Insect repellent that is DEET containing and particularly high amounts of DEET are protective against ticks.
I think a lot of folks are nervous about DEET.
Mm-hmm.
So can you share with us any advice to help alleviate parental fears?
Yeah, so we know that children over age 1, DEET is safe. Lower concentrations, but DEET is safe even in pregnant women.
I think that's really important because a lot of people are afraid, and I'm like, no. We need the DEET.
We need the DEET.
We need to be protected.
Right, DEET on ourselves when we're going outside. And then another thing is you cannot just treat yourself, but you can actually treat your clothing in a way that's a little bit more long lasting. You know, otherwise we put on insect repellent before we go out, we take a shower, it's gone.
Yeah.
When you treat your clothing, there's something that's called permethrin that you can get. Follow the instructions on how to treat your clothing, your shoes, your bags, etc. Camping gear, if you're going out camping in the woods. And that's longer lasting.
So I'm going to ask you a really detailed question that I'm not sure if you'll have the answer, but I literally, in preparing my daughter for camp, sprayed down every single article of her clothing and her bag and her shoes with permethrin spray.
Yes.
But it said on the instructions 4.5 grams per article of clothing. And I was thinking, so how many sprays is that?
Yeah, I usually do like 1 or 2 sprays and you're good.
Oh, good. Okay, so I probably overdid it, but that's okay.
I think that the 4.5 grams it was probably a few sprays, but I think 1 or 2 and you're good.
That is very relieving as well. And so I think parents out there might have the same question that I do when you get the bottle and you're like, how do I know how much? So I'm just thinking back to Nicole's question about her child who just went on a hike. Is there anything that, parents should know to help guide their kids when they are, like from a behavior perspective, they can do?
We talked a little bit about where ticks like to be. Because they like grasses, they also like the edges of grasses. And so the edges of trails where there are tall grasses, staying in the middle of a trail, or if there are grasses in the middle of a trail, staying away from that grass that's sort of isolated. And then after you're out, there are a few things to think about after. So tick checks right away.
Yep.
There are places where ticks like to be.
This is really important, by the way, because if you're not with your kids, how do you instruct your kids to do a tick check? So
my kids are trained.
Okay, good. I'm working on it. So help us all.
And they're little. They can be trained.
Okay, good.
So ticks love places where they can hide. They love, creases in our bodies and places that are dark and warm. So they love, the finger and toe webs. They love the hairline behind your ears.
Yep.
They love your underwear line.
Okay, so when I said that to my daughter, she was like, they're in my underwear. I'm like,
yes, maybe, I don't know, have your mom check or check in the mirror rather than asking somebody else, right?
Yes.
So, and then the other thing is, oftentimes they're not strongly attached for hours after they're on your skin. And so taking a shower right when you come in. So you spray yourself, you treat your stuff, you go out, you avoid the areas where they're more likely to be, you do your check, you come in, you take a shower. All of those things will decrease your risk of being bitten by a tick, and if you are bitten, contracting Lyme.
That's really valuable. My kids were asking me very, very concrete questions like, how big is it? What will it feel like? So I would imagine it's just a tiny little bump.
Yes. So growing up in New England, this was something we were very familiar with. So this is not like growing up in Florida. No. This is, an everyday occurrence.
Yeah, we worried about alligators, not ticks.
Right. So we think of deer ticks as very small, like the size of a sesame seed. Very small. They almost look like a little freckle on you.
Wow.
But without realizing it, you know your freckles, you know your skin, and so oftentimes you can look and see what doesn't fit.
Okay.
You'll be able to see them. They're dark, they're obviously there. And so then the next question becomes, what do you do when you find a tick?
Yes.
And it's attached.
Yes.
Right?
Yes.
So you want to take tweezers, go close to the skin, and pull straight out.
Okay.
Because we talked about you can have that reaction or you can have a local infection, I oftentimes will swab over with alcohol after. It does burn a little, but I do like to do that as one extra step.
Okay, so grab those tweezers.
Straight out.
I
firmly
hope the
close to the
those.
skin. Yeah. And then if it is engorged, one thing that you can do is you can save that tick. I know it sounds gross, but after you've, taken it out, you kill the tick, you can burn it.
Oh.
Or you can put it in alcohol. And then you can save it to either show your doctor, or if there's a question of whether that tick has Lyme, you can actually test the tick. Now, there are things you can do if you have a high suspicion that your child has been bitten by a deer tick and it's engorged and your child hasn't yet contracted Lyme, so it was recent, you can actually do 1 dose of antibiotics. This would be in conversation with your doctor as a preventative measure.
That's really helpful.
Rather than a whole treatment course if your child contracts it. But of course, that's a discussion with your doctor if they think that makes the most sense for your child.
So I have another question, too, about this. If you have darker skin, is it more difficult to see the ticks? And are there any hints for those?
Yeah, so sometimes I like to use special flashlights, like we use pen lights in medicine, or small, skinny flashlights, and illuminate the skin. Okay. And then you can see if there's anything that's a bump.
Wow. So literally transillumination, like
essentially, but it's more like down the skin. Yeah.
Yep. Okay. Yeah. Wow. Okay, good to know, because I'm thinking that these are important things.
Mosquitoes like certain blood types, but ticks like anybody.
Yeah, I'm tick naive, so this is very helpful. Thank you. Well, okay, so we talked a lot about how to prevent.
Right.
How is Lyme disease diagnosed?
Sure.
And how do you treat it?
Lyme can be diagnosed based on the group of symptoms. If you have a bullseye rash and you have a fever and you have some joint pain, for instance, there are blood tests that can be used to look for your body's own immune response to the bacterial infection. So this is looking for antibodies specifically. That takes time to develop, because your immune system has to form that response. And so if you test early, sometimes that can be negative even if your child has Lyme. And if your child has had a past Lyme infection, in some cases those antibodies will be positive for life. And so that can be a little bit difficult to interpret. It's a discussion with your doctor, an evaluation with your doctor, whether they think that your child has Lyme, based on the combination of their clinical symptoms and then potentially blood tests.
It's really important for parents to be aware of that, like when they're talking about that with their doctor, that the blood tests may or may not be indicative of a recent infection.
Exactly.
Okay.
And then the treatment is antibiotics. It's a course of antibiotics. Okay. When the antibiotics are done, the bacteria is gone. But there is the possibility of complications long term in a small but significant number of patients if you don't treat it early.
What is that window that you ideally want to treat?
Yeah, weeks. And generally, the most common complications, if it isn't treated within weeks, is arthritis, joint swelling, pain, redness. And it tends to be a few joints, oftentimes likes the knees, likes the larger joints. Doesn't tend to be a whole body arthritis, head to toe, everywhere, symmetric. That would be a different kind of a thing. Sometimes it will cause a facial palsy. Sometimes people have heard of something called Bell's palsy, which is facial palsy. That's when you don't know the cause. Yep. When we know it's caused by Lyme, we don't call it Bell's palsy.
So it sounds like if you get treatment within that, sort of immediate time period, the risk of long-term side effects, is that essentially go down dramatically?
It's lower, but I will say that Lyme is an infection that can cause long-term symptoms, and it's not unique in that. It tends to do it more than some infections, but there are other infections that people will probably have heard of, those post-infectious complications, like things like long COVID, which is also called post-acute sequelae of COVID-19. You have the infection, you get better, maybe, but then you have long-term symptoms. And the symptoms often have an overlap. Mono, the virus that causes mono, can do the same thing. So you can have these long-term difficulties, fatigue, headaches, difficulty thinking, difficulty concentrating, joint pain other places.
Just one of the many types of infections that can have a long-term impact.
Exactly.
You were saying that sometimes we don't even know that we might have been bitten by a tick that may have been carrying Lyme disease. So at what point should, parents or individuals consider Lyme as a concern and need to be tested or evaluated?
One important point before I launch into the rest of the answer is that actually most people who contract Lyme don't know that they've been bitten. The vast majority of people I see are like, well, my kid didn't have any tick bites. And you say, well, they're really sneaky and they're small and they hide. And so it's not at all unusual for, your child to have had one behind their ear tucked in for a couple days and you didn't see it. Many things are patterns. What's typical of a Lyme infection? If your child has an unexplained arthritis in one or a few of their large joints, could be Lyme.
Yeah,
right?
That's pretty unusual.
Right.
In a
kid. Your
kid.
child has a facial palsy, could be Lyme.
Yep.
Your child has fevers, headaches, neck stiffness, unexplained, could be Lyme. Your child has fatigue, some fevers, a rash, could be Lyme. I think a great question that we haven't really addressed is people will show a picture of a bullseye and say, is this by definition Lyme? And the answer to that is not necessarily, but often. So that target tends to be fairly specific, not entirely, but fairly specific. Whereas if you have a red circle, it could be a mosquito bite that had a big reaction, could be you tried a new soap, could be a number of different things.
And for any parents that are listening right now thinking, oh, maybe my child did have like a swollen knee such and such time ago or something like that, like what should they do?
Sure. I think talk to your doctor is the biggest thing. I have had many conversations with people where they say, thinking back a couple of years ago, my child had this and this and this, and we test, and sure enough, they have Lyme antibodies that are positive. They were never treated. And we say, okay, let's go ahead and treat.
And you still treat even...
You still treat.
Time, like a long time after. Is there any time limit?
No. If you know about it, treat it and see if whatever symptoms you're having improve.
Now, another question that's coming to my mind, too, is our pets, right? Because our pets are going outside. If they have white underbellies, they might be attracting ticks. So how do we protect our pets, and how do we protect ourselves from the ticks that they may bring in?
It's a really good point, and it's actually something that I take in my history when I talk to parents and families is, do you have any pets at home? Pets often bring in the ticks. Yeah. And if families aren't doing routine tick checks, they may not be finding the ticks on the pets. My dog, he has a lot of fur, and it's white, and it's hard to look through it all. Yep. And so he gets ticks sometimes. And, last year it was nighttime, and I felt something crawling next to me along my leg in bed, and I turn on the light, and there's a dog tick. And I hadn't been outside, and it was probably from the dog. In New England, believe it or not, if you test pets, many, many, many times they're positive for Lyme.
Wow.
When you check their Lyme antibodies, they're positive, right? And so, I actually had somebody ask me just today, how come there's a vaccine for pets and not for people? The basics of the story are that the vaccine for pets is not perfect, but it is important for them because so often they're infected.
They're just so high risk.
Exactly. They're so high risk that even if you're lowering that risk to some degree, it's beneficial.
Yeah.
So that risk benefit there makes sense for them. The interesting thing in talking to my dog's vet is that vets don't always treat animals every time they're positive. My dog, there have been many times over the years we're getting routine blood work and, he's positive for Lyme again. And they're like, well, is he having symptoms? And he might have been limping, and if he was, then we treat it. If not, we just kind of let it ride.
Yeah, they probably built up immunity and are so exposed.
Exactly.
But they do have a vaccine, which maybe helps.
They do have a vaccine, and I think if you have pets, being mindful of we're out in a place. It's hard to keep them in the center of the trail. You're not going to treat them with permethrin or DEET. But just doing those tick checks, trying to be mindful of where they are, and then if you want, you could do things like give them a bath and look through their hair or brush them. That helps with a tick check in the dogs.
Yeah, so tick checks, vaccines to help protect your pets and to hopefully decrease the risk of you getting a tick from them.
Yeah, risk to your family, exactly. Yeah.
But no DEET for the dogs.
No DEET for the dogs. And, it's all in the context of what makes sense for you and your family. Yes, having a pet in the home may increase your risk of having ticks in the home, which may increase your risk of contracting Lyme. But at the same time, if a pet is an important family member, you have to figure out the ways to live your life and minimize the risks and be mindful of things. But you can't let, worries about things like Lyme paralyze you.
Yes, exactly. I think that's a very good thing to remember. Don't let it paralyze you. You got to still live your life. Mm-hmm. Well, this has been really helpful. I can't even tell you enough, how much I've learned. What's on the horizon in the world of Lyme disease?
Yeah.
Where is the research going?
There are different research studies looking into improving methods for diagnosis and detection, especially early, because there is that lag between when you're exposed and when your immune system has that initial reaction, and you can detect the antibodies. There are also studies looking into how do we best treat neurologic Lyme, so what we call neuroborreliosis, when Lyme affects the central nervous system, and looking at specifically whether oral doxycycline is enough to treat. When I was training, we would have to admit people to the hospital for 3 weeks of antibiotics.
I remember those days.
Yeah, or send them home with a PICC line
Yep,
to treat
yep.
their Lyme meningitis. And now we don't do that anymore. We send them home on oral doxycycline. And then also in the realm of vaccines, you know, we have a vaccine for pets. We don't have one for humans. And
Yeah.
what's on the horizon there?
Well, I'm definitely ready for a vaccine against Lyme disease. I'm all in.
Me too. Me too.
So I don't have to stress as much. Thank you so much, Dr. Wilson Murphy. Now is my favorite part of the show, which is called Doctor's Orders. And this is where you, as our guest expert, offer an action that parents can take to help raise healthy, happy kids. So, what are your doctor's orders today?
The most important take home from all of this is that being outside is really important for the health and well-being of our population and our community, including our children. And there are mindful, thoughtful ways that you can do that in a relatively safe way that takes into account Lyme and ticks and all the benefits from being outside.
What I take away from that is that it's so important to be able to enjoy life, get out there, and also there are many things we can do to protect ourselves from Lyme disease. So
Absolutely.
Thank you.
Yeah. Education is power.
That's right. Thanks for joining us today. As always, thank you to our guest parent, Nicole, and our guest expert, Dr. Molly Wilson Murphy. Really, this topic was so important to learn and help us all how to be safe outdoors, but also enjoy the great outdoors. Till next time.